Well, it's obviously winter. I'm all rugged up and slight wind blowing. The cat's around here somewhere trying to annoy me. But I want to talk about breathless incompetence. Breathless incompetence. I cannot believe I am living in what is supposedly one of the most developed, sophisticated nations on the planet. I'm not talking about our culture, but I'm talking about our ability to deliver. The rollout and the response to the COVID-19 crisis in Australia has been totally abysmal, totally incompetent. And there are three main reasons, and they're all tied up with the concept of capitalism, private investment for private profit, and outsourcing contracts to private organisations to deliver services which are essential, which should be delivered by governments at the local, state and federal level. Let's look at the journey since March 2020, when COVID-19 became an issue in this country as well as around the world. It's a pandemic. And the response. I'm not talking about the economic response or the moral response or the cultural response. I'm talking about the government's response to the crisis, how it has responded. Now, first of all, at the very beginning of the COVID-19 crisis, there were doubts amongst government circles about whether it was a crisis or not. People talked about another flu. They didn't seem to understand the reality of what was going on. But once that was accepted, especially when the COVID-19 crisis broke out in Victoria and the deaths which followed, the infection of almost 20,000 people and over 700 deaths in Victoria, people began to take it seriously. The first issue has been the fact that we don't have a national emergency services centre. We don't have a national diseases centre. So to try to put forward a national response is difficult when you've got no coordinating organisation. And other premiers and the Prime Minister have been meeting some sort of special cabinet. Their responses to what's been happening have been pathetic. Let's start off with hotel quarantine. Now, when the borders were closed and people were denied permission to leave this country, over 75% of people who wish to leave are not given permission to leave. In many regards, a little bit like North Korea. But let's accept that this was done in order to decrease the chances of COVID-19 becoming an issue. Quarantine. As I've said before, quarantine stations have normally been on the outskirts of cities since the 19th century, when it was observed that quarantining did save lives. So what did we do? What did we do in the 21st century? What have we done in the 21st century? Well, we have quarantined people in the central business district in hotels which are not fit for purpose. Everybody's known since March 2020 that COVID-19 is an aerosol droplet spread disease. So what do? We quarantine people from overseas in rooms which are not fit for service, which are serviced by private contractors who are not given the appropriate education and equipment to deal with quarantine failures. So obviously we have quarantine failures. We've currently had 25 quarantine failures, which have led to economic shutdown, which have led to unnecessary deaths and hospitalisations. Totally unnecessary. The only quarantine facility fit for purpose is in the Northern Territory. And they haven't had any breakouts. They haven't had any failures, like all the centres in the CBD. And to rub salt into the wound, 18 months after the pandemic began, the Morrison-led Liberal National Party government has been forced to agree to construct and help finance one fit-for-purpose quarantine centre in Victoria. And where do they place it? Do they place it on government land? No. The Morrison government has decided to place it at Avalon Airport, which is privately owned. That's right, privately owned land. They never seem to learn the story that if you want to deal with a pandemic or an emergency, you need to mobilise all the services which the state is able to provide without outsourcing that responsibility to a private sector whose major concern is to make a profit out of providing that service. And you increase your profits by underpaying your staff, by not training them adequately, by not providing the service. And we, the rest of the community, are expected to pick up the tab. That's just the quarantine centres. Now, the experts will tell you there's only, there's been 365,000 people go through these quarantine centres. Now, obviously there's been 365,000 people, and they say there's only a 1 in 25,000, 1 in 30,000 chance of a breakout. That's if you include the COVID-19 negatives and the COVID-19 positives. And only about 1 to 2% of people who return from overseas are COVID-19 positive. And when you look at the percentage, it's not 1 in 25,000, it's a failure rate of 1 in 178. For every 178 people in quarantine with COVID-19, the infection breaks out once in every 178 cases, which is an extraordinarily high breakout rate. Even now, they're not talking about funding commonwealth facilities on commonwealth-owned land around the country in each state to deal with this situation. Now let's look at the vaccine rollout. There is nothing has been as pathetic, as incompetent as the vaccine rollout in this country. And once again, it took months before the state governments were forced to provide fit-for-purpose quarantine centres. But what did they do with these centres? They once again have outsourced the delivery of the service to the private sector. In Victoria, which is currently going through a lockdown or has just been through a lockdown, it's almost impossible to obtain a telephone appointment or an online appointment because the system can't cope, because there aren't enough people there to ensure the system copes, because again, it's privately contracted out. I've got nothing against private organisations, but they need to make a profit. And that's why the service never reaches the standard that you would expect from a public facility. And even if you line up, it can take hours, days, in order to receive a vaccination. And while we're talking about vaccination, let's look at the lukewarm response to vaccination hesitancy in the community, where a relatively rare, exceptionally rare side effect from the AstraZeneca vaccination has been blown out of all proportion by the corporate-owned media, and the government has done almost nothing to overcome that vaccine hesitancy. And when you look at its advertising program, which you're paying for, when you look at the way it has been handled, you can understand why people are hesitant to receive a vaccination, because of the propaganda against vaccination, which has reached epidemic proportions in this country. So we've got a government which is not willing to provide fit-for-service quarantine services, and even when it's forced to provide one in Victoria, and it'll take 2 years to build, it's built on private land, not government-owned land, so we have to pay rent to that provider for eternity, whether the quarantine station is used or not. And then we have a vaccination program which has not even been able to vaccinate the most vulnerable members of society. It's all very well having a 1A and a 1B category for vaccination, but when 6 months after vaccination has begun, you haven't even vaccinated 10% of the staff in aged care centres, or all the nursing homes and aged care facilities that need to be vaccinated. And when we're talking about a 10% vaccination rate among disability service providers, and the fact that it's becoming almost impossible to receive a vaccination, you then begin to understand that this is incompetence at a breathtaking level. It's incompetence at every level. It's easy to complain, very easy to complain. But over the last 18 months I've been providing suggestions on how to solve these issues that occur over and over and over again. And obviously, because this is, seen by a minuscule fraction of people, obviously it has no throughput, but I'll go through it again. The first thing we need is a national emergency centre, not just for pandemics, but for fires, floods, droughts, earthquakes, and the list goes on and on. And this National Emergency Centre needs to have facilities in 50 regions in this country, not based on a state network where political leaders within that particular state will use that emergency in order to solidify their position on power, but regional networks which are funded by the Commonwealth government, which are there constantly to provide that emergency relief. If you don't have a coordinating emergency service, nothing will change. Secondly, as we've seen with contact tracing, we need to stop relying on the private sector. We need to stop outsourcing services which should be funded and provided by government to the private sector. Not only is it economically inefficient, because 40 cents in every dollar is lost in terms of profits and administration costs, but the fact is that we have seen over and over again, whether it's hotel quarantine or the vaccination rollout, that they are not capable of dealing with emergency, and a pandemic is an emergency, not just because of the effect it has on the population health-wise, but the effect it continues to have on the livelihoods of thousands of Australians, if not hundreds of thousands, who will take years to recover from the financial setbacks which have occurred and which will continue to occur until this country is vaccinated. So we need to have a health department, a health component to these emergency service, which can be activated to roll out vaccinations or roll out support. Now obviously there are volunteer organisations around the country, but volunteer organisations are volunteer organisations. They cannot provide the services which can be provided by a commonwealth funded organisation, a coordinated commonwealth funded organisation. Because if you think there will not be any more pandemics, or more fires, or more floods, or more cyclones, think again. As we enter a climate emergency, these problems will become more and more and more common. Therefore, as a society and as a nation, we need to be in a position where we can deal with these emergencies. And if we're not, we will continue to suffer because of it. Now this piecemeal, state-based response in a federation is useless. We need to divide Australia up into say 50 regions, not based on state borders, but based on geographical realities and population. And these regions can then respond at a local level if they're funded properly by Commonwealth and state governments to provide those necessary services. And if they can't provide those necessary services, other public facilities can be used to provide those services. So think about it. We can either trundle on the same incompetent, inefficient pathway and continue to give out, outsource government responsibilities to the private sector and continue to make mistakes, or we can look at another way of providing those services. That's what public interest before corporate interest is all about. It's about using our common resources to deal with these situations. That's what we are about. We're about using the commonwealth for the common good.